the lap
Started
band.
when you were 3?
Oh, yes, when I was a fetus. We do the lap band in Nashville.
Right.
We do the Roux-en-Y in Nashville. And I could have had some of my very best friends do my surgery for me in Nashville, and I chose a total stranger in Las Vegas. I could have had my dearest friends give my anesthesia in Nashville. All those things are very big pluses.
Right.
But the point was the procedure and to find the right person to do the procedure. And I chose Dr. Rutledge to do my procedure because I kind of thought there were some well-trained people that you had trained
Right.
around the country. One very close to my original home in Michigan where I could have stayed with family and friends, and that was tempting. But I thought very often medical professionals, if somebody's going to fall through the cracks in some way, it's going to be one of us.
I think we've both seen that, where
Yes.
if you have a nurse or a doctor who's having a procedure, they
Yes.
seem, for some reason, to
What is
kind of-
that?
They're like a magnet. They get the complications. We've had that here in town,
Yes.
just to digress for a minute. One of the leading back surgeons went to have a facelift, which is generally considered not
Yeah.
major surgery, but kind of more, not quite minor, but by one of the best plastic surgeons, kind of everybody agrees, one of the best plastic surgeons, and the patient suffered severe brain damage just from a facelift. So you're right. We I think have to worry as
Yeah.
medical
We do.
professionals. Somehow there's the world tilts and the nurses.
Well, us or someone we love, we take them to the hospital. They have the same risk factors that we have.
Yeah.
In that regard. And so I thought, even though I trusted your judgment and all the wonderful surgeons around the country that you had trained, I thought I needed to go to the source for this operation. And so that's, I mean, if
So
you're
we're
flattered
here.
by that, then
So
I'm
we're here
glad.
today at the source.
At the source. And then, all of that was really reinforced because when I came, I was here in May of '05 for my surgery, and then I came back in July of '05 with a friend. And you invited me to come into surgery and observe. And my support person had been an anesthesiologist, and she
Right.
had been invited to come and observe. And she was kind of dragging her feet all the way, but coming with me to make sure I got a fair shake. And when she went and observed the first procedure, then you took the second one back, I was the third one, she came back to my room and she said, "Oh, Debbie, we don't worry about this anymore. You were so kind to let her." She said, and it was true, when I observed, when I came back in July with my friend when you invited me to come and observe, I did, I think, the first anesthetic for a laparoscopic procedure in Nashville as a student, because that surgeon who brought laparoscopic procedures to Nashville happened to be using the facility where I was a student. And so I've seen a lot of laparoscopic surgery, a lot of laparoscopic surgeons.
Right.
And you need to plug your ears for this, because I know you hate my anesthesiologist friend and I both agree we have never seen anyone so elegant with that instrumentation. That's true. Elegant